everybody's seeing the right thing. Please let me know if you're not. But I love University of Redlands, and I was just telling everybody that the last time I was at this speaker series was actually the day that I interviewed at Esri. So that's been about 6.5 years, and I'm really thrilled to be back. Tonight, I really want to take this opportunity to talk about the ways that GIS technology has been used to respond to the COVID-19 pandemic. Over the last 10 months with our customers, of course, we've gone through several iterations of collecting and connecting dots in new and innovative ways to better respond to this coronavirus. And mapped information, I'm sure you all know, I know I'm preaching to the choir here, it has been front and center during the pandemic. And you might make the argument that GIS has actually never been more important than it is right now. And it makes sense, of course, when you think about it and the roots of GIS. It is, of course, a technology that's based on geography, and geography is the science of our world. So when we think about it, geography provides that rich content that describes our world. There's biological content, a lot of that right now, ecological content, sociological content, any of the ologies that you happen to like. And that content is put into context using a common reference system, and that is, of course, geographic location. And that geographic lens really helps us to more easily see and digest complexity and relationships and patterns. And I think this is part of why people really love maps. And I think that this science really brings it all together in such a remarkable way that helps us to better understand, and it helps us to intelligently respond. And as you likely know, and maybe you've seen this before, a GIS is much more than a map. So I'm speaking to those of you who may be less familiar with GIS right now. A GIS is a system that provides a kind of a framework and a process for tackling almost every kind of challenge that people need to address. So I personally like to think of it as a workflow. And we know in analysis, many workflows begin with data and measurement. And we then want to be able to take that data and visualize and analyze it to start to develop a deeper understanding. That gets us to the important stages of planning and designing our interventions, making decisions about priority, how, when, and where to act. And then we can take that action and monitor or evaluate our outcomes. So a modern GIS actually has tools to do all of those different things. And again, for any of you who may be new to GIS, I'm not going to try and teach you everything about what it is, but I do think that it's important to note that a GIS system is capable of reading in all kinds of data, whether it's tabular, imagery, three-dimensional data, real-time data, or even actually unstructured data. And that ability to integrate all of those different kinds of data types by their common geographies is really one of the things that makes a geographic approach so darned powerful. In other words, it's a way to link up data sets that you might have thought were unrelated. And using this kind of system, I've actually seen quite a lot of innovation, again, over the past 10 months. And I'm going to share some of that amazing work with you today. But I will just start by saying that some people don't believe that you can or should innovate during a crisis. But I will say that in my own experience and according to the Harvard Business Review, which maybe you'll take more seriously, a crisis creates a number of conditions that work together to support rapid and impactful change, just like we've been seeing. So one of the first things that happens is that an organization unites around a shared purpose, and that really enables this sense of courage to take action that might have been unthinkable during more calm times. Now, a crisis also tends to magnify and clarify where there are vulnerabilities and problem areas, and this kind of forces us to confront our systems that may not be working optimally and see them a little bit differently, and it tends to generate new ideas. Now, the other thing that happens is that there is a lot of incentive to move quickly, and that can help us to overcome bureaucratic red tape. And of course, as you well know, a crisis creates a lot of energy just to go forward, to get things done. And when that energy is focused on a common goal, a lot of innovation actually does get done. And that innovation is really what I want to share with you tonight. And I will show you why the geographic lens is so powerful in this particular case of COVID-19 and the pandemic, and why it actually helps us to go beyond collecting the dots to using place and location analytics to connect those dots in ways that create new insights and new information, and it informs our actions going forward. And so I want to share these innovations in an organized way around 4 different patterns of use that we're seeing deployed across the board. So then I'm going to actually show you how those same patterns can be applied to other health challenges, just to get you thinking about some of these things, because there is so much that we're facing in our communities and our countries. And I would just say, if we're going to gain anything from this year, these challenging times, I think it's going to be the lessons that we've learned and that we've already applied to make ourselves and our countries, our jurisdictions, more resilient and more responsive going forward. So let's begin with mapping and monitoring disease. This is a familiar sight for everyone, the world famous Johns Hopkins University dashboard. Actually, I just saw today that Time magazine is naming Johns Hopkins dashboard as one of the 20 greatest innovations of 2020. I first came into contact with this dashboard on January 23rd after seeing a tweet from the JHU team. And I took this and showed it to my whole Health and Human Services team at Esri, and we all really liked it because we thought it was really very clear in its messaging. They did a really nice job in their design. Well, I guess we weren't the only ones who thought so, because the dashboard ended up having tremendous uptake. It quickly became a backdrop in operations centers around the world, from the US Health and Human Services Secretary's Operations Center to emergency response meetings in Germany, to coronavirus briefings going on in Italy, and you can even barely see it in the background here in a newscast in Ireland, among so many others where it was featured. And now the influence of this dashboard broadened significantly when respected journalists started writing about it. And the coverage was quite extensive, but some notable examples included the New York Times, BBC World News, and actually our own Esri website used it for a landing page that was focused on providing COVID-19 resources. Now, the whole story behind the dashboard was featured on National Public Radio. It was in Science and the Nature Index and the Wall Street Journal, among many other publications. And actually, I was even invited to talk about the dashboard and mapping coronavirus on CNBC News. Now, the dashboard went viral very quickly, and this graph is showing you the first 3 months of feature requests starting from the dashboard's introduction. So I just want you to take a really close look at that scale on the vertical axis. Each division is actually 500 million feature requests. So at a peak in late March, the dashboard was being requested 4.5 billion times per day. Now, of course, compare that to the current world population, and I think you get a sense of how remarkable these numbers truly are. And so I want to just take a moment to mention some of what I think are key outcomes from just this one single Johns Hopkins University COVID-19 dashboard. First, I would say it broadly demonstrated the value of GIS for health applications to a global audience. Second, I would say that the fact that the JHU team put data sharing first was a huge enabler, and it helped all kinds of organizations, including so many health organizations, to visualize, analyze, plan, and make better decisions in their COVID-19 response. Now, this is, of course, what open data is all about. And not only that, but the JHU data by comparison, I think, really exposed gaps in our public health systems in collecting and sharing data with the public. And it exposed a lack of interoperable systems that could be federated up to provide a cogent national picture. And all of this inspired a lot of questions about who should be the authoritative data resource in a situation like this. And I think these kinds of questions aren't really meant to be so critical as they are important points of discussion. And I think that they really have the potential to enhance public-private partnering and improve our capabilities for the next crisis. And finally, the JHU dashboard, because of its regular updating, tended to build an expectation among all of us, myself included, for real-time and near real-time data. Now, if you don't know, we've never really had this in health data before. So it is a completely new expectation. And I have a feeling that this is really going to help push technology systems, not just GIS, but all kinds of systems forward in what I think will be very desirable ways. Now, beyond the idea of alerting the world to the developing crisis, the JHU dashboard inspired others across the globe to configure their own dashboards to map and monitor disease, like this one that was built by the Africa CDC. And it shows the COVID-19 status for an entire continent with the option to be able to focus in on various regions across Africa. In South America, we can look at the country scale, and we can see that Colombia, especially early on, was paying really close attention to the origin and the importation of cases in their country. In Australia, for the state of New South Wales, the University of Sydney took their analysis down a scale, right? They went all the way down to the postal code. And then on the left, you can see they had this handy filter so that you could really home in on some of the higher risk populations in that area. In Asia, Hong Kong was sharing data for sure on cases and hospitalizations, and then they were also mapping the actual buildings where there had been confirmed cases. So a whole new level of scale here. In North America, the state of Maryland shares their data at the zip code level, along with detailed information on testing volume and the percent of positive tests. Now, as a leader in transparency, this state is also sharing this dashboard, indicating ventilator trends and availability, as well as this remarkable dashboard, which gives statistical information for each and every nursing home in the state. And dashboards are being used for more than just the raw case counts. Here's an example. The University of the Aegean is really interested in the Southern European countries, showing places where young people are at higher risk of unemployment due to the pandemic. So I hope you can see that across every continent and at every scale, even all the way to the region of Timbuktu in Mali, people have been mapping and monitoring the disease, often with dashboards, to really understand what was going on with the novel coronavirus. Now, there are countless examples of how health organizations have been mapping and monitoring disease to give them a better handle on what their populations are experiencing. Infectious disease surveillance is probably, I would say, the most common area of work, from things like mapping malaria transmission in Kenya to the presence of African swine flu in South Korea. But many are also mapping chronic diseases like cancer and diabetes, obesity, smoking and drinking, among many others. And in a different, especially geographic area, understanding the impact of context is important for several health problems, like monitoring for lead poisoning and for low birth weight babies. And we also are seeing more and more efforts that are focused on operational types of workflows, like this example on monitoring wastewater for the presence of opioid medications and their metabolites, or monitoring patient flow through a hospital like they're doing in Argentina. Mapping and monitoring disease is actually a great place to get started for GIS for health. Well, next, we're going to dig into analysis, which is one of my favorite areas because I feel like you're being a disease detective, figuring out where's the problem, where's it changing, what are the underlying causes, how can we improve outcomes for people in the community, or how can we forecast or predict what may be coming next? Well, a common analytic function for health is about understanding gaps in services or health outcomes by figuring out who is more or less likely to be affected by something. Now, those that are more likely to be affected are what we call vulnerable populations. With COVID-19, people could be vulnerable for any number of reasons, and we can visualize and analyze those. So let me give you some examples. It may be older age or medical comorbidities that make some people more susceptible to severe disease. So disease susceptibility risk or vulnerability. People could be vulnerable because they are essential workers and they're more likely to be exposed to the virus. Or maybe the vulnerability is actually just because they live in congregate housing situations. So that's places like nursing homes, university dormitories, or prisons. No matter what it is, we can overlay various kinds of vulnerabilities and find the highest risk places for COVID-19. We also used analysis to perform capacity forecasting. So this is where we used a model that takes in hospital bed utilization data along with social distancing behavior information, and we can start to understand what might happen over time with local hospital bed capacity. That could be regular hospital beds, ICU beds, or actually even ventilator capacity. So you know that every hospital and every government wanted to be able to predict whether their curve would essentially stay flat, which would indicate that they can maintain their health system infrastructure and the ability to care for each and every person that walks through the doors, or actually if some hospitals may become overwhelmed and exceed their capacity to provide care. Something I'm personally worried about with the Thanksgiving holidays and actually in some places right now. Harris County, Texas is another example. They did analysis to look at accessibility of testing sites for COVID-19, and they coined a new term similar to this idea of food deserts. They detected testing deserts in their community, and these were the places where people just didn't have good access to getting tested for the virus. And here's another form of analyzing relationships using GIS. And web. And yeah, not so in you know, or understand what kinds of guidelines are needed and what may work. Go on for days about this particular pattern and how analysis applies to health concerns outside of COVID. But first, I'm going to take a drink. It's been a long day of using my voice. Okay, so around the world, there is a lot of effort to use mapping, particularly at this point to better understand disparities, racial and ethnic disparities, or notable vulnerabilities like they're doing in Finland. We know in Lebanon, they're using mobile survey tools to better understand the lived experience in disadvantaged neighborhoods. And across Europe, they're looking at civil unrest, and they want to identify and manage those pockets of unrest, especially in the areas with high COVID case counts. GIS can actually make the complex more simple. That's part of the beauty of it. And one great example of that, I think, is the risk factor map that I'm showing here for homelessness. Because when you can understand that certain areas experience more homelessness because of unemployment, while other areas are generating homelessness because of domestic violence, well, those are so very different. And when you understand the location aspect, you can put the right interventions in the right place to help solve this problem. I also really like the analysis of Aedes mosquito habitats, not the least of which because I'm a co-author of that study, but it is a good study. And this is looking at those habitats around the world so that we can better plan mosquito control efforts to prevent Zika virus and dengue fever and chikungunya. Okay, we are on to the third repeatable pattern that we have seen a lot of for COVID-19. And I kind of group these under the idea of strategic planning. Now, as I'm sure you all are well aware, two staples of geographic problem solving are site selection and calculating the geographic accessibility for places. Now, these methods have been used in COVID for things like standing up new testing sites, distributing food resources, and extending healthcare services in those places where hospital capacity actually does become overwhelmed. Now, this uses a process that we call location allocation. And let's say that we wanted to stand up new testing centers, maybe in those places that I showed you in Texas that were testing deserts. Well, for COVID, we would begin by determining the population demand. And that is, of course, an economic term. Health people would say the population need for this particular service. So you do that by overlaying all of the factors that are contributing to each of the 5 COVID risk types. And I sort of mentioned some of these before. There is transmission risk, socioeconomic risk, susceptibility to the disease risk, exposure risk, and resource insufficiency risk. In the end, these combine to create risk ranking over small geographies that may be of interest, like say neighborhood geographies. And so then to calculate the best testing center locations, you apply the risk rankings, but you also add information on the road networks so that you can ensure a reasonable travel time or travel distance or walk time to your new testing sites. Then you actually can put in other kinds of constraints that you might have. Like maybe you only have a budget for 10 new testing sites, or you only have staff that can support 5 new sites. Whatever all of your constraints and the factors are that you want to include in the model, it will take them all into consideration and select the most optimal sites from the entire population of options available. So let's say you did that. You cited a bunch of new testing centers, and then the next step, again, thinking of our workflow model, that this is a continuous process, you want to get people to the new resources you're providing. So you use resource locators, like this one that actually comes from Valencia in Spain. Now, when a user puts a pin on the map or uses their cell phone location, for example, excuse me, they can get information about the nearest hospital or pharmacy or social services or, of course, testing sites in their area. And I think there's really no question that COVID-19 inspired great innovation in connecting the dots to support response to the pandemic. So, going even a step further, we saw GIS used in the large-scale COVID-19 testing that was done recently in Slovakia. Now, they aimed to test their entire adult population over a couple of weekends in October. And GIS really provided residents with up-to-date wait time information. And that data helped people to self-distribute among the different testing sites because they could see it all on a dashboard. And that regulated the overall occupancy at each site. It improved the ability to socially distance. And people got through much quicker compared to other parts of the country that weren't using this dashboard. This was mostly done in Bratislava. So the whole thing turned out to be a real win-win for everyone. So now I'm going to take a few minutes and actually dive even a little deeper into two important strategic planning areas that are going on right now: contact tracing and planning for vaccine distribution. As you may know, contact tracing is a process that health departments perform to help break the transmission chain of the disease before an infected person has a chance to spread that infection to other people. Now, I actually became a certified contact tracer just so that I could make sure that I understood this process. And so we are using GIS to help in a number of ways. We're trying to help health departments that need it to be able to collect and manage their contact tracing data, to do rigorous analytics, certainly where location has its strength, and evaluating the entire process. So this is a sample contact tracing form from the US CDC, and they have a section on this form called the Exposure Information section. I blew that up for you on the right so you can see it a little better. And this section is the only section that really asks location-oriented questions. They might ask, have you traveled domestically in the last 14 days? And if somebody answers yes to that question, then the contact tracer is asked to fill in, well, which state did you visit? Well, I think everybody on this webinar realizes that states are pretty large areas, and that level of location simply isn't useful. So we developed apps to make gathering finer scale location information, as well as conducting all of the interview questions, really pretty quick and easy. So once the data are collected, whether using our apps or some other method, health professionals certainly need to be able to perform analysis. And this is especially important for COVID-19 because a lot of the viral spread happens by community transmission. In fact, we actually coined a new term in this case. We call it community contact tracing. And the idea here is to recognize that community or location component of the process. What it basically means is those people who are getting sick can't always identify how or by whom they've become infected. So in the process, we start with the locations that we collected in the contact tracing interviews, and then we take that information, again, even if it comes to us in a simple spreadsheet, it doesn't have to be through our app, and we can put it on a map. And of course, that just marks the very beginning step in a spatial analysis. Well, maybe the first analytic function that you would perform would be a density analysis. And of course, that's visualized here as a heat map. That might provide some very early clues about higher risk locations. The spot that's lighting up on the screen for you now in this example is a nursing home. But that's when you start to dive deeper because you're going to develop questions and want to figure out the answers. So you might move on to link analysis. So link analysis gives us a better understanding of person-to-person connections. And that's important, right? That is the whole thrust and the intent of the traditional contact tracing method, and it remains very important. But we can also use tools from graph theory with the link analysis to help us to determine the strength of person to place connections that are so important when we're talking about community spread of disease. Well, we can use dashboards. Of course, dashboards are a term and the app of the year. Dashboards are a great way to evaluate and improve our contact tracing process. By monitoring how we're doing, we can help with things like identifying and coaching contact tracers that maybe aren't keeping up, or hiring new contact tracers if the workflow or workload is the problem. Or maybe we can identify other bottlenecks in the system that could impact its efficiency and its effectiveness. And efficiency is probably the biggest key word for contact tracing because you only have a short period of time to stop and break that transmission chain. So this kind of a dashboard could be really critical to improving the process. Now, the other area that I wanted to touch on a bit today is planning for equitable and efficient distribution of vaccines across each country and around the world. And there are, you've probably been reading about it, some very complex and challenging issues in this effort that I think GIS can nicely support, like identifying the facilities that can store and administer the various vaccines because they have different criteria, determining where concentrations of high priority populations are, exposing gaps in access to vaccine and formulating plans so that we can actually reach everyone who wants to receive a vaccine. GIS can help manage and monitor the vaccine administration and inventory system, as well as share progress on vaccination delivery across our communities. So let me show you. For how vaccine delivery quickly important because we need healthcare infrastructure to take care of them. Things we to suffer disease like the essential workforce, and those most likely to transmit disease, like people living in congregate populations easier. Populations are to able to populations to be out of reach of venues that we already have plans and population. Pharmacies, distribution, and for that reason. examples can experiencing through or walk vaccination clinics. Now, the fourth key task in the vaccination delivery system that we're talking about is tracking and managing the vaccine inventory, along with actually the vaccine distribution kits and the PPE inventory, because you need all of those together to be able to deliver the vaccine. So a pattern I've already mentioned a few times is going to be dashboards and mobile tools together. They're a very powerful combination for many kinds of health applications. In this case, we can use mobile tools like Survey123 to read the barcodes on the vaccine cartons. And you can actually, because they've got rules associated with them, you can parse that barcode information into relevant fields and populate them automatically, like the quantity contained in the carton, the lot number, and the expiration date. This makes inventory check-in and check-out really easy, right? All you got to do is scan that barcode, maybe name your facility and the date, and you're done. All of this movement of supplies in and out of inventory is monitored, of course, in real time with connected dashboards. So not only does that give you situational awareness about how much vaccine you have, but you can start to use this to figure out when and how much more to order. And you can be efficient about making sure that you use the vaccine doses before they expire. Because, of course, we know that the vaccine manufacturers are going to be working really hard to provide lots of vaccine, but it's not going to be enough, right? We've got a global population that needs this. As this enormous global challenge continues to evolve, it's going to be important for decision makers to evaluate the process and the productivity of each vaccination venue. And I personally think that it's going to be equally important to share vaccine progress with the public. We really need that transparency and communication. Trust is going to be probably one of the most important factors in trying to achieve vaccine-induced herd immunity. Strategic planning in health, or actually in any other sector, is really about applying whatever limited resources we have in the most effective ways possible. So here's some examples. Health facilities are certainly being cited all over the place, but specifically here I'm showing you in Kenya and Oklahoma and in Japan. And then a lot of people are focused on getting people to their healthcare appointments. So we see planning efforts to provide public transportation and ride-sharing options. And nowadays, health organizations want to consider providing services digitally through telehealth or e-health options. Folks are using GIS to determine things like, is there sufficient need for those services by assessing the travel burden across their communities? They might also check to see if the broadband coverage is adequate for those kinds of services. And by the way, this is also a general measure of digital equity, right, that can be applied to understand where greater investment is needed to support digital access to information and education services, to name just a few important areas. And finally, GIS can support telehealth services by informing which health service offerings are most needed by the underlying population. In other words, what kinds of specialists do you need to be in your telehealth appointments? Now, the last of the repeatable patterns that I wanted to cover is indoor space management. With COVID-19, we know that disease transmission occurs more easily in enclosed spaces. So this topic becomes extremely important to consider. In fact, as we've seen in numerous studies, sharing indoor space is a major SARS-CoV-2 infection risk. And while organizations are faced with a lot of important decisions nowadays, when they're thinking about, are we reopening or are we shutting down again? I would say that probably the most important question of all that they're trying to grapple with is how can we prioritize health and safety for people inside our various buildings? Now, a lot of organizations are paying really close attention to indoor space planning in order to be able to bring employees back to workplaces or to reopen restaurants or schools and universities. And you probably are aware of ArcGIS Indoors, and it's being used to analyze seating arrangements and spot areas where we don't have at least 6 feet of physical distance between workstations. And you can see those overlapping areas in red on this particular graphic. Once you have this information, of course, it becomes very efficient to make the proper adjustments. Inside our buildings, I think there's no doubt that we need more rapid response, right? We have to pay better attention to things like sanitization. Maybe we're placing new hand sanitizing stations, or we're planning the disinfection procedures for janitorial staff. So we're going to need to be able to make service requests very easily and quickly from mobile devices and monitor the progress in one place. Sounds like another mobile device and dashboard combination. Like I said, those are pretty powerful. Now, we also have the opportunity to track devices in our buildings and the surrounding areas. And by doing this, it becomes really easy to spot potential problem areas of high traffic or prolonged dwell times. And if an infection were to arise in one of our buildings, we can use proximity tracking to support public health contact tracing efforts. The indoor space management pattern is absolutely the newest of the patterns that I've shown you. And even so, we're seeing the concept of indoor GIS provide a lot of value for health organizations. The effort could be as simple as visualizing an entire hospital campus, like the BIM model that you're seeing from Norway. In Indonesia, they're using their building models to ensure safe evacuation in the event of an emergency. And then large campuses like Harvard University or University of Toronto are making navigation very easy. Now, that same use case actually is critical for hospitals. So has anybody ever been in a hospital? Then I think you probably know what I mean. They are always confusing. And one of our hospital customers, our mutual neighbor, Loma Linda University Health, has not only improved indoor navigation, but they've also worked on managing patient flow through their clinics to improve efficiency and patient satisfaction. There are a lot of opportunities, I think, to bring indoor GIS to the world of health. You know, I think we're never going to forget these stories that we have this year of our isolation and our quarantine, and as Californians, our new curfew, if you've read the news. We're not going to forget all of the local social distancing efforts that go on, the X's that mark the spots, the hunt for toilet paper, completely unnecessary, but very true, and the creative ways that we've all worn face masks when we're in public. And of course, my sincere hope is that we never forget the valuable lessons that we've learned along the way. You know, I mentioned in the beginning that it's not uncommon, actually, to see innovation alongside a crisis. And actually, in the GIS world, this remains very true. Back in 2001, 9/11 taught us a lot about the importance of integrating our information infrastructure in advance of an emergency. Hurricane Katrina demonstrated the need for better national preparedness overall. And the 2018 Camp Fire, which of course devastated portions of Paradise, California, showed us the importance of communication and coordination. As those lessons were realized, the technology evolved. We built web services to facilitate data sharing. We created story maps to more effectively communicate. And we now have hubs to connect and engage communities. And so, how are we going to remember this event? How will future generations judge us in this year plus that we're experiencing? Do we think we were as prepared as we could have been? How can we better interconnect our systems at all levels and support a clear need for finer scale and real-time mapping? Can GIS help us better coordinate our responses across governments and at various scales? How can we do a better job of sharing authoritative data that everybody's able to use to make better decisions? We need to incorporate these lessons that we've learned from COVID-19 into our organizational workflows in a way that will prepare us for whatever comes next. Let's keep the innovation going because it's never really been enough to simply collect the dots. Technologies like GIS support health and help us to connect the dots in ways that inform and inspire and instigate changes that will make us all healthier. And so I want to thank you for your attention. And I, of course, wish you all good health. And I think that we have some time to take some questions.
Well, thank you very much for such a fantastic talk. Dr. Sarkar is now going to be moderating the Q&A session, and I'm sure there are lots of questions.
Okay. I'm ready.
Okay, wonderful. Esri, thank you again. This was a delightful, enlightening talk. Thank you very much. I reiterate thanks on behalf of all of us. This is again a polite reminder for the audience that the chat has been open, and please keep sending us the questions. Let me begin by asking this on behalf of perhaps all of us. We have, after several months of not so good news, finally gotten some good news in the last week or so with the pharmaceutical companies coming up with the vaccine developments and sharing them with us. You talked about vaccine distribution and the role that GIS can play, of course, inherently and natively spatial aspects of vaccine distribution. If I could connect this back to the testing deserts that you were talking about, do you anticipate any role for spatial, and if so, how in inequity in terms of vaccine distribution as well?
Yeah, absolutely. And it's a great parallel with testing sites. So I'll give you a really quick example of also the parallel here. One of the things that the Biden administration is planning, and they've released their COVID-19 task force plans, is to double drive-through testing centers. And so we've been looking at this and wanting to help. And the first thing that we were thinking was, well, that's great to double the number of testing centers, but what about the people who don't own cars? So they do have a strong focus on equity, but we think about that equity differently because we're spatial thinkers. And I think the same is true for vaccines. We need to think about all of the different aspects that may act as barriers to people getting the vaccine. So that's why I think it's not only going to be important to have lots of partners, pop-up vaccine clinics or drive-through clinics or walk-up clinics, but I think the mobile outreach and optimizing those routes to serve people is going to be equally important.
Excellent. So the next question that is coming up has to do with concerns regarding privacy and perhaps even breaching some ethical frontiers. We have seen countries worldwide which have deployed mobile-based apps that track people's movements and alerting them when they are going into perhaps a territory or an area that they shouldn't, and based on their their own health or the health of that community. Spatial, of course, mobile geolocation data has become a price commodity or a data asset information product for the private sector. As we see our own perceptions about privacy evolve, I guess the question is, at this time, what trade-offs do you see in terms of using mobile geolocation in tracking people's movements and our own perceptions and biases about privacy versus thinking about the public good that comes from the use of such data?
Yeah, it's in a way it's a tough question, and in a way it's an easy question. The tough part is if we had all of that tracked information, public health would be a lot easier. If we also had the technology to know what to do with that information. There's public health is underfunded and understaffed, and technology needs facelifts sometimes in some health offices. So given if we had the ability to use that information, it would be extremely useful. However, and before I finish that thought, I would say we saw it was useful in China and other places where there's a different relationship between the government and the population. And so without any judgment of what that means or what it is, it's a different relationship. In this country, it just wouldn't fly. And I think we know that. And we saw efforts to create apps, and we saw even some state governments try to stand them up, did some of this proximity tracking, but there was never enough participation to make it worthwhile. And even so, public health departments complained that one, they did not think it was ethical. They did not have a good use for the information. So we chose, from the Esri perspective, not to get involved in that aspect. Plus, there's another technical feature that makes it undesirable in our opinion, and that is that GPS is not able to distinguish two people on different sides of a wall, or separated by glass, or two people sitting in cars waiting for a train to go by. But the GPS might tell you that they're close contacts. And so you would end up with a tremendous number of false positive notifications if you were to rely on that kind of technology at this point. So it's a very interesting question. The only place where we think it's potentially possible is in workplaces, which is why I brought it up in indoors, because I think, one, you have the opportunity to opt in or opt out and have your location tracked. People may trust their employer more than they trust their government. So depending on the kind of organization, it's possible there. But I think even if you did it anonymously, it could be useful information to understand dwell times within buildings and high traffic places. But yeah, I'm not a big fan of the overall proximity tracking, even though, in an ideal public health oriented world, it would be very efficient.
Of course. Excellent. The next set of questions, if I could subsume, have to do with just what we're seeing in the news, unfortunately, is this recent surge that has been happening. And of course, the number of positive cases seem to be spiking up to very alarming numbers, especially as we approach Thanksgiving next week. And as recently as today, we are seeing the CDC advising folks to, curtail holiday travel. So the question comes from the perspective of many cities, including large cities that are neighbors of ours, are struggling to figure out what may be the causes, of us experiencing these spikes. Cities seem to sometimes, for lack of a better way of putting this, fumbling around with all this massive amounts of data that are coming in. If you were to advise a public health team in a large city about, how best to deploy spatial location-based intelligence to deal with the surge and stay ahead of it, especially when it comes to this next several critical weeks leading up to the holidays, what would that be?
Well, I think the public health departments maybe don't need as much of my advice, except for I think that contact tracing information and the anonymized aggregated cell phone information, as well as visitation information for specific sites to understand where some problem areas are. And so they can really focus in and maybe adjust guidelines to really specific places or types of places. For example, I looked at one state, not California, but another state, and found that restaurants are having high visitation at this time, and the visitation at grocery stores has gone way down. So you can see a sort of overall shift in the population. They're starting to go out to eat again. That's like a really specific thing that the government can create guidelines around, right? They can have restaurants close or partially close or be takeout only or whatever they choose to do. What I guess I think would be even more effective, because public health, like I said, knows mostly what to do, is if people would just wear masks and socially distance. And for everybody who's remaining on this call, we're going to see bigger spikes after Thanksgiving because a lot of people won't adhere to guidelines. We know that's true, but don't be one of them. I hope, I hope our families will still be there. We can Zoom with them, but hospitals are getting near capacity in a lot of places. And we don't want to come through the holidays and lose family members. So it concerns me very much. And I think it's population level behavior that's going to be the most effective caution as we move forward.
Excellent. Thank you for that. This following question, I'm starting to see the names of the individuals who are asking questions. Comes from Kerry Sen, who is a former colleague of ours. Kerry's question is regarding the recent passage of Proposition 24, enhanced opt-in carrier responsibility in the California Privacy Rights Act. Any thoughts that you might want to share with us on its impact regarding the collection and analysis of person-related data? I guess it goes back to the prior discussion that we were having.
Yes, so I will disclose, my husband and I voted oppositely on that one. I won't say which is which. I felt like some of the concerns that I had with that proposition was some lack of specificity. And, there's so much concern in the country now about privacy, and I totally understand it and I get it. And we want to keep information safe and secure. Super important. What I worry about is that people will not understand the laws. This happens a lot with HIPAA, the law that sort of governs health information. They don't understand the laws well enough, so their response is kind of the knee-jerk, I'm not doing anything. Let's leave geographic information alone. It's mentioned in HIPAA, we're not doing anything. Yeah. And so that could be a real inhibitor, not just for geographic data, but for all kinds of data. So there's this balance of privacy and open data that can be shared and used productively. And I really want us to find the middle ground where we have really good, safe, secure systems, safe ways of presenting geographic data and other kinds of data, and the correct laws. So Prop 24, I don't know how it's going to work, but I hope it doesn't become a big barrier to good work.
If I may, a couple more that have come in. This is coming from Jeremiah Bradley from the University of Redlands. Jeremiah's question is regarding the fact that he aspires to become a medical professional himself, and he's looking to better understand the medical industry. With the establishment of the vaccine, the upcoming vaccine, hopefully in 2021, and its supply and distribution challenges, if one were to pursue a career, if you may, broadly in the field, and consider the GISP certification, the GIS professional certification, how do you think you know, that kind of a career aspiration versus bringing in the geospatial expertise and knowledge go together or blend together?
So, and please make another comment if I don't answer your question the way you intended.
Mm-hmm.
But, you know, I mean, it's an interesting question because in some ways I feel like my experience has been a little bit toward the unicorn style because I chose a medical career, I practiced medicine, and then for a while I combined it with spatial epidemiology. And so in an academic career, of course, you have the opportunity to practice and do research and teaching. But I will say at my time, and there wasn't a really powerful WebGIS when I was practicing medicine at that time, I didn't do a lot of applied geography or GIS. I did sort of research and then I did clinical. It didn't combine. I would say if you were interested in combining these careers and becoming a GISP, there would be a couple of great paths. One would be to use your medical knowledge and become, like a great analyst leader, and probably mostly focused on the analytic pieces. But if you wanted to stay a clinician, then you could be a real champion for hospitals that are forward thinking and using GIS to do things like guide patients to resources in their community, because you will have this overall awareness. You can use resource locators. You could probably get involved in helping patients understand location-wise where there are clinical trials near them for the diseases they have. Clinical trials are always under-resourced, right? You never have enough bodies in those trials, and yet they can be a great experience for people. You could work with graduate students, medical students, and residents to apply geography to impact community health, or work within a hospital's community benefit department to use your hospital registries to improve things like leg amputation from diabetes, develop partnerships, that kind of thing. So again, I don't know if I'm exactly answering the question the way it was intended, but I think there are some, I think at this point, you kind of have to do what I did and invent your path, follow your passion and be good at it. And then you can kind of turn it into what suits you best.
Well, let me piggyback on that last point of yours. Your path has certainly been remarkable and has taken you from academia to government, now into the private sector at Esri, of course. And all of these stakeholders, if I may, continue. This probably is that time where the intersection of these three stakeholders, right? Their cooperation and their collaboration is so key in helping us move forward from what has been an enormously challenging time in contemporary human history. Big picture, what advice, if I may, would you have for any one or all of these agencies, if you may, broadly, in their role in shaping how we move forward?
It's a great question. I guess being in all of those different kinds of organizations, one of the things I learned, sometimes painfully, while being at Esri, is that in academia and in government, and even in healthcare, there is a distrust and a dislike of private sector businesses. And it's really interesting because I think many of the people on this call know that, Esri is a great organization, incredibly philanthropic. We have this disaster response program where we helped over 5,000 organizations this year. And we build a product that has value. And some of these other kinds of organizations often don't see that. They don't want to purchase value. And so it's an interesting dilemma, because I think sometimes people don't realize those in private industry also have families and need to keep the lights on, and we're all doing our jobs. So I guess what I have learned and what I would like to see going forward is this sense of everybody has something important and unique to bring to the table. There's not an evil one or the other. And we need to use all of those. I mean, we need the academics to really prove the science. We need public health to build the policy and disseminate some of that. We need our healthcare workers to employ the best practices to take care of individuals. And we need our vendors to bring value and make things more efficient and possible for all of these other organizations to do their jobs. So I guess that's what I would want to say about that.
Okay. Well, let me, before I pass it back on to Jim, I see him popping back up on the video. Thank you so much on behalf of myself and all those in the audience who passed questions on via the chat. Thanks for taking the time to be with us tonight. Appreciate you reconnecting with us. Jim, do you want to take it over at this time?
Oh, yes. Esty, thank you very much for an outstanding and insightful talk. One of the points you made is that in COVID, GIS technologies themselves have been pushed very hard and given new uses. It's convincing from your talk that GIS has a huge role in responding to and mitigating the pandemic. It's a topic of immediate and crucial concern nationally and globally, and you have done a wonderful job in showing the panoply of this to us. Also, thanks to you who have attended the event and for the very thoughtful questions and discussion. Thanks to Dr. Geraghty, a video of this talk will be available soon on the Center's website. We hope you can attend upcoming Center speaker events in the winter and spring. So thanks again and good night. Thank you.